Thank you for joining me today, Shelia.
You are
I'm
quite
so
welcome.
excited. I'm so excited. You know that um, we're both members of the Quill. We've both gone through the author incubator. And there are always people that you meet and you go, wow, that person, and you're one of those people for me. You're one of the wow, that person, because you
Thank you.
have a special glow about you, first of all. And then you look really interesting. And then you open your mouth and my God, it's even more interesting. And then the title of your book, To Pee or Not to Pee, my goodness, Hamlet's one of my favorite Shakespearean plays. I saw that and I was just naturally drawn to you. But for people who don't know who you are Dr. Shelia Craig Whiteman, and you live in Maryland, and you've written this wonderful book. Would you please tell me a little bit about your background to share with the audience?
I sure can. My background, actually, I'm a physical therapist. I've been a physical therapist for more years than I want to count. But I also specialize in pelvic floor physical therapy. So that is primarily the background that I used to write this book and to put the information out for the general public. The subtitle of the book is The Guide for Reducing and Eliminating Urinary Incontinence. And it is such a large, pervasive, really, issue in the community of women, men not so much, but we don't talk about it and we don't address it until it is really too late, or until it's gone on so long. So that's kind of why I wanted to write the book, and that's my background in actually thinking about writing this.
That's so great, because people always talk about, oh my God, I laughed so hard I peed myself. That is just such a common thing. And yet people don't necessarily make the connection between that and physical therapy or their pelvic floor. Now, I'm normal in going to my gynecologist every year and making sure that that whole area is okay. I do the whole upkeep. But pelvic floor is a concept that I had not heard of until I went to a yoga class.
Yes. They talk about
what is pelvic floor?
Yeah, and that's a really good question, because a lot of people don't know that there are, kind of know that there's muscles there, but you don't know what they do. So the pelvic floor, actually, it is 3 layers of muscle, and the muscles have different functions that they do. So there is the first layer actually helps support the outside organs and your clitoris, sexual function, sexual enjoyment. The second layer is where those sphincters are. So that when you say, for example, even if you have a bowel movement, you have to open and close your sphincter. Other than that, it would just come out. And the same thing for your urine. So this is what gives you the control of your bowel, and your bladder is the second layer, which is your sphincter layer. And then that third layer is the layer that holds everything up to where it's supposed to be. So you want to look at, it keeps the vagina in position, it keeps the bowel in position, it keeps the uterus actually in position, it holds everything up. So that third layer, all layers are of course very important, but that third layer is what we really think about when we're strengthening. And I know this is a long answer to your question, but that is the layer that you really have to try to hit when you're doing the strengthening and you're doing Kegels. Hence the problem that people don't do them correctly.
Well, speaking about Kegels,
yeah,
that is something that as a young woman, I heard that only in a sexual reference. To do Kegel exercises to enhance sexuality and pleasure and all that.
Yes.
However, as a physical therapist, you teach that in a very different way, I imagine. Or maybe
I do.
I don't know.
Yeah, I do. I really don't focus unless a person comes in with problems and questions about sexual dysfunction. So I will back up a little bit because what pelvic floor physical therapists do is not limited to urinary incontinence. So we also help people with issues with their abdomen. Because people have surgeries, they have scarring, they have pain. We also help people with post-pregnancy. So people do have issues post-pregnancy, especially if you've had a traumatic birth. And we do a lot of education prior to. We help people with constipation or people who have bowel leakage, then bladder leakage. And we also help people with sexual dysfunction. There are a lot of women who have pain with sexual activity, especially penetrative intercourse. So depending on what you come to see us for will depend on what your plan is. Now, that being said, when we look at Kegels, we mostly look at them for strengthening to prevent a lot of the issues and problems that women may have if their pelvic floor is weak. And we see people because they're having issues. That's why they come to therapy, or even why they look for a coach, which is what I have transitioned to do. So they will look for someone to help them with their problem. And their problem usually is not for us, I want a stronger orgasm. That's not what they say. They go to someone else probably for that, but we don't get that. We get when people have issues, either sometimes when they can't have an orgasm, we do get that, but we get when people are having urinary leakage, pain in the pelvis, things that physical therapy, physical therapy is the most appropriate for a referral, or for someone who's looking for that and knows that there are pelvic floor coaches out there who can help them.
No, it's when I read your book and I saw Kegel, I said, wow, because that was the only context I knew it in. But could you explain what a Kegel actually is? Because maybe some people are as misinformed as I was.
So a Kegel is actually, and we're trying to move away from just saying Kegel, because you are absolutely correct. Everybody knows that word, but to know exactly what it means is a different story. So a Kegel is a pelvic floor strengthening. It's pelvic floor strengthening. So those muscles that I talked about in the beginning, those 3 layers, a Kegel is what you want to use to focus on strengthening those 3 layers. So it's not just a matter of just squeezing, because a lot of people think that if you squeeze, that you have accomplished doing a correct Kegel. And you really, on the squeezing, you would hit the first layer, of course. You would hit the sphincters, mostly the bowel sphincter, because it's stronger and because it's holding solids. So you would hit that, but you have to really make sure when you're doing your Kegel that you're hitting every layer and not substituting muscles. So when I was in the clinic, we look at how strong people are by doing a lot of times a digital in the vagina, but glove finger, of course, but you don't have to do that. But that's when you're in the clinic, you can, because just to see what's going on. So when I do that, and I've treated hundreds of women, so, and it always just, I just love this part, because to me, it's always been hilarious. But when you ask them to do your Kegel, okay, let's do your Kegel, let's go. And all you really see is, or, the body tensing, and they're swearing that they're doing this Kegel and doing, I did it, this is the way I've been doing it, this is great. I said, but I didn't feel anything in your pelvis. So you really have to make sure that you're targeting the correct, you're targeting the correct muscles, because if you're not, you can exercise everything else. Because if you do a good hip adduction that's bringing your hips together, you're going to feel like you're doing a Kegel. Like you're going to feel everything moving, and it's very exciting, but you're not hitting what you're supposed to hit.
Right. Exactly. And this is why people would need a physical therapist or a coach like you to show them, to teach them.
Right. Yeah. If you're having a problem, if you're not having a problem, then, you really wouldn't even think to look for someone to be able to help you, because it wouldn't even dawn on you, because you're like, what do I need help for? But if you are one of the women, and let me just say, research, it used to be about 60%. So now we're up to almost 70% of women who have said that they do leak a little when they cough, sneeze, laugh. Exercise.
Yeah.
Okay, so if you're leaking, it's not normal if you're doing it a lot. You know, every once in a while, your bladder might be full. You didn't go to the bathroom, you know, in time or whatever. Somebody says something, you just cracking up, because if you have a good belly laugh, it just relaxes everything. And we all want to have those.
Right.
So you might have a little bit of leakage. But, you know, if every time you're laughing or every day you notice a couple drops are coming out, it actually is time to seek help. Don't wait until the waterworks start coming. And then you really have to work hard to be able to solve your problem. It's solvable.
So what can a young woman do, let's say a 20-year-old that has no health issues yet, maybe planning to have a family, planning to live a long time and not have this problem or this source of embarrassment? What's the best way to keep a healthy pelvic floor?
So the best way to keep a healthy pelvic floor is actually to do pelvic floor muscle strengthening. It actually is. But you can also do pelvic muscle strengthening having a lot of sex, you know, because your muscles do tighten, orgasm. So you can actually have it like that too, which is why a lot of younger people, especially people who are really sexually active, they don't notice that they have leakage, etc.
Oh, wow.
But younger people, usually, and this is way off of younger people's radar if they don't have a problem, because young people, and I, you know, I would, you know, we all had that mindset where you're going to live forever. You're young. It's okay.
Right.
So you don't really have the mindset of really even doing anything to take care of yourself going forward. These are your fun years. But when you think about having children, is really when you, especially after you have your child, especially for people who, you know, are having children, that's when you really want to start thinking more about your pelvic floor. So you think about it then, or you think about it, and this is only when you're younger. Now, when you're older, it's a different story. So when you're, after you've delivered, and even before, if you're fortunate enough to get into a program that talks, and it's just educational programs that they have for women who are pregnant, who give you a little bit of information about strengthening before and after, and also give you information on making your birth a little more pleasant. So that is out there. It wasn't when I had my children, but now there is a lot more education.
That's fascinating.
So yeah, so that's younger. And then of course, older people, 40s and up, you actually just have to do pelvic floor strengthening correctly, period.
So you would recommend everyone by the age of 40 start looking into that? And
I would, and there is a caveat to that. So if you have pain, pelvic floor pain, or if you have any kind of discomfort doing it, then that signals something different, because there are people who have tight muscles in the pelvic floor. They have pelvic floor spasms. These muscles work the same as any other muscle. You can have a spasm, you know, in your leg, you have a spasm in your hand, etc. So they work the same. And usually the spasms are either there's nerve irritation, there's something else going on. So in those cases, pelvic floor strengthening or Kegels is not actually indicated. You first need to find out why this is happening. And then once you get that situated, then you go back to making sure your pelvic floor is stronger.
right. So no one should really self-diagnose. They should see a professional.
They should see a professional. You can, and it's not self-diagnosed, because if you don't have anything really that's concerning you, you can go ahead and do Kegels. This would be the same as taking care of exercising your 30 minutes. That is, now don't do Kegels for 30 minutes, but it's the same as doing your recommended 30 minutes a day exercise. That is the, American Exercise Council. So it is the same thing. Our muscles have to be exercised in order to stay strong and to stay even flexible.
That's great. Well, I really loved your book. I've loved talking to you. And I'm sure that people are watching this and saying, how do I know more? How can I find out more information or get your book or contact you? So please tell people how they can learn more.
I sure can. So there are a couple things. So my book is going to be in bookstores in January. If you want to get a physical copy of the book, you can also order it off of Amazon and get a physical copy. If you want a digital copy, now I give digital copies away for free. I want as many women as possible to read this and to get as much information as they can. So the digital copy you can get from my landing page. You would just go onto my landing page, put in your name, email, et cetera, and you would get the digital copy. And that is to P-E-E, or not to the number 2.com. To P or not to.com. Now, you can also send me an email. I love emails for this particular subject. Not always, but my email is thepelvicdpt@gmail.com. Easy to remember. So the pelvic, I'm a doctor of physical therapy @gmail.com. So those are the two best ways if you want to get a copy of the book. I also have a Facebook page. I do post information on that. It's health wellness _ Dr. Shelia. So there are several ways I want to make sure that you can get me. If you want to find me, you can get me. So you can look at any of those ways to try to contact me, and I will be more than happy to answer your questions or even to help you if you have an issue.
That's wonderful. Thank you so much. This has been so much fun. And
You are quite welcome.
To P or not to P, make sure you get a copy.
Yeah.